Core20 Plus Connector Programme, and I'm really pleased that this session is being delivered by Peace, who is the Health and Wellbeing Development Manager at the Caribbean and African Health Network. So I'll pass over to you, Peace, and thank you very much for coming to deliver this session for us.
Yeah, hi everyone. Good morning once again, and thanks for the opportunity to be here. Just bear with me, give me a minute, and I'll share my screen. Can I just confirm that you can see my screen, please?
We can, yes.
All right, thank you. Yeah, so I'm here today to continue this series on mobilizing the Black community for improved health and well-being. And our focus will majorly be on the Core20 Plus Community Connectors program, just giving you an insight into CAHN strategy. So briefly, I will talk about CAHN. Our vision is to eradicate health inequalities and wider disparities for Caribbean and African people within a generation. And our mission is to ensure that the strategic and operational actions of service providers across health and cross-sector agencies and commissioners lead to racial and social justice for Black people. So for our objectives, we work collaboratively with Caribbean and African faith and community organizations to strengthen the structure and systems so that they can be responsive to meet the health and well-being needs of people from our community. And then we also build partnership across sectors. We also engage in continuous consultation, planning, and evaluation to provide solutions to persistent health inequalities. And lastly, we champion the work of Caribbean and African community by promoting its assets, efficiencies, and then achievements. Yeah, so why CAHN was set up? There was a problem, so I'm just highlighting 5 of it. So in terms of like why CAHN was set up, discovered that there was poor access for Caribbean and African people accessing healthcare. And then there was that underlying historical issue of lack of trust, and people from our community, from the Black community, not trusting the healthcare system as a whole. And then there was that like poor engagement. We were being termed as the hard to reach group, but then it's like there was that difficulty in I would say healthcare providers getting through to people in our community, and which resulted to poor or lack of engagement. And then inadequate knowledge of research. Yes, we agree that we have research, but then there's a paucity of research for health conditions specific to people or that affects people in our community. And then there's that bias of structural system, processes, and practices. And then some of the structural barriers, just highlighting a few of them. So in terms of like decision making and representation, that's like one of the major barrier. Not having people from the Black community being seated in decision making rooms. That benchmarking to majority populations where we just generalize things, but then there's that difference. And then racial discrimination and unconscious and conscious bias, then poor engagement and investment, especially in faith sectors. We know that people from our community are so much on faith, either maybe from any aspect of faith, but then you mostly would get to engage them maybe in a church or in a mosque, but then there's that poor engagement and investment into like faith sectors. Yeah, so in terms of our area of work at CAHN, we have our community empowerment and advocacy service. We have our health and wellbeing service programs and initiatives. We have an education, training, and leadership development team. We have our infrastructure and capacity building team, and also research and innovation. And all this embeds between evolves around eradicating health inequalities and disparities. And then for our corporate affairs units, we have the people team, the finance team, the IT team, business development team, and some others you can see on the screen as well. I'm just wanting to highlight some of the health and wellbeing services, programs, and initiatives we have in CAHN. So I'll be talking more on the Core20PLUS5 Community Connectors program. But then we have the Living Well program, the Green and Arts Wellbeing Service, physical activity outreach, health screening, and outreach program, which I think for the last series we'll have one of our health licensed practitioner coming to speak more on that. And we have our weekly health webinars. I'll be talking on more on that in the next 2 slides or so. We have the harm reduction initiative, and we have the knowledge access screening for improved health, which is CAHC. I think we'll be speaking on that in the next series. We also have our hospital discharge service and then our counseling service. So yeah, in terms of improving health literacy, like I mentioned in the previous slide, that we have the Caribbean and African Targeted Health Improvement Program, and it started in May 2022 during the pandemic. Since then, we've been live on Zoom every Saturday from 11 a.m. to 12:15 p.m. in the afternoon. And then it's more focused on health conditions that disproportionately affect people from our community. We have Black clinicians, specialists that come to talk about some of these health conditions. Well, they present on the topic, and then people on the platform are given the opportunity to ask questions, and these questions are well addressed. And I think just as I said, it's hosted by volunteer CAHN medical leads and other clinicians. Yeah, 40 to 60 minutes presentation in a particular topic, and then follows by a Q&A session. And then afterwards, there's an opportunity for a follow-up one-to-one consultation with the GP consultants or specialists who came on that day. Yeah, so these are just some of like the flyers we've had in past. So I think the first one talked about Black women's perinatal and mental well-being. And there was another one on shining the spotlight on dementia in the Black community. I think on my top right, the chart just talks about like the attendance we've had so far. I think I'll move on to the next slide. Yeah, so why we're here today. Core20PLUS5 Connectors program, and then an insight into CAHN strategy. The Core20PLUS5 Connectors program is an NHS campaign, as most of you will rightly know, to reduce health inequalities. And then CAHN was commissioned to run that for Greater Manchester. So I would just be taking you through breaking down what Core20PLUS5 is for the benefit of those who don't have an idea about it, and how that fits into our health priorities in CAHN. And then our strategy. So Core20PLUS5, the Core20 there is the 20% most deprived population according to national statistics in the UK. And then we know that the Caribbean and African community falls on that 20% most deprived population. And then for the plus group, there is the integrated care system. That's the ICS chosen population groups experiencing poorer than average health outcomes, either poorer than average health outcomes, access, experience, and then outcomes. And they were not really like captured in the 20%, in the Core20 that I stated earlier. So such groups, but then would benefit from like a more targeted or tailored approach. So for example, people with disability. And then the 5 key clinical areas of health inequalities that was the Core20PLUS5 is focusing on is the maternity, that's maternal related conditions, severe mental illness, chronic respiratory disease, and then cancer, and lastly, hypertension. And just as you see on my top right, it fits well into our health streams at CAHN. We have 6 health priorities: cardiovascular, cancer, mental and emotional health, respiratory conditions, bloodborne and immunological conditions, and lastly, reproductive and sexual health. And then going to my left, mostly what we do, it's We provide culturally appropriate community services, and then projects and initiatives. And then we're also set to influence health policies and insights through some of what we do, our research, our projects, and then, yeah, our services, and then improving health literacy of our community. Just as I stated, one of our key priorities at CAHN is improving health literacy, and that's what we do every Saturdays for Health Hour. And also in line to improving health literacy, every Tuesday we meet, there's also a session just similar to the CATIP Health Hour sessions on Saturday, but then that's more focused on like healthy lifestyle and diets, where we have like nutritionists, dietitians, and then the last 30 minutes, we have a physical instructor who takes people on the, that joins the call through physical activities. And so that's on every Tuesday from 6 p.m. to 7:30 p.m. Right, so for the GM, the Greater Manchester Core20+ Community Connectors program and objective, like I said earlier, is focused on the Caribbean and African ethnic communities across Greater Manchester. And then one of the objectives as well was the recruitment of people from focus groups on barriers to accessing primary care. And then PCN survey and engagement, working with voluntary sector organizations. So I would just want to talk about the second objective, where we recruited people. We had about 4 focus group sessions, and then we recruited people with the 5 health conditions that were focusing on Core20+5. And then we wanted to know what health meant to them, and then some of the barriers they've experienced in terms of like accessing primary care. I'll be sharing some of what we got from those focus group sessions in coming slides. But then the third bullet point talks about PCN survey on engagements, working with voluntary sector organizations. We wanted to know, what are some of like the projects and initiatives that PCNs have actually done in the past or are doing, just scoping for best practice. And then we also did that in turn with voluntary sector organizations, wanting to know what are some of these projects and initiatives, whether anyone specific to the Black community, what were like the outcomes or learnings that they got from those projects. And then we went on to recruit and train 30 people with lived experience. So yeah, we call them community connectors. And then basically their role is to advocate for the community using their lived experience to work closely with primary care and the GP team to improve, well, could be the care pathway, or just basically to improve access, address some of these barriers. And then the long goal is to improve people's health outcomes. And then lastly, developing community connectors training, including knowledge of care pathways. So, I mentioned that the one of the objectives was to have a focus group session. So what we heard from the focus group session, there was that poor health literacy, people not actually understanding some of these health conditions and how it affects them. And then assumptions from health providers. Some people felt like there was that assumption from health providers. They felt like the communication was poor, poor access to primary care, be it the online or phone consultation constraint, limited involvement in decision making about their care. They didn't feel heard or listened to. There was a stereotype, lack of involvement, how like they are perceived in their own culture, discrimination, language barriers, social isolation. People felt often dismissed, and yeah, this is some of like what we heard. Just breaking down some of that into things. So what we also did late last year was doing a thematic analysis of the focus group sessions, and we drew out I think 6 themes. So in terms of culture, just read, someone said, I felt that I could not really speak about my own food as my GP had a big question mark on her face when I told her what I had eaten before the appointment. And then in terms of poor prioritization, my GP was slow about conducting some health checks when I stated my concern, and I had to go to A&E instead. If I do not push, I will not get a good health check. And then in terms of poor services, there was no follow-up on medication prescribed by my GP to see if it's working. And then this worsened my situation. I think I'll just read the last bit on poor communication. Stopping my prescription without discussing it with the patient can be very unpleasant. And my concern to my GP is misinterpreted for something else because we cannot understand ourselves. What is written down is different from what I explain. So you can just say these are some of the barriers to their experiences and then assessing primary care as a whole. Yeah, basically, there were some suggested recommendations in terms of what could be done better. Just as you can see on the screen, developing pathways to support NHS and creating more targeted resources, involvement of faith and community leaders, which is very vital. And there should be more alternative care to prevent health from deteriorating. I won't want to go through everything, but then GP suggestions that were raised in the focus group session. And yeah, I just want to basically talk about, focus more on the community connectors role. I know I mentioned, summarized what their role was about, but this is just like some bullet points to highlight the community connectors role. So you have to be a voice that identifies barriers and champions change for people experiencing health inequalities. And then to work with PCN and service users across the 5 health priorities. That would entail co-designing and co-production of care pathways in priority areas according to the local needs. And then also building on enhanced existing local community-based initiatives that focuses on the 5 key priorities for Core20+. And to make links with groups and networks that may want to be involved, including bottom-up approaches to reduce health inequalities. To connect healthcare service providers with communities to improve health with a focus on the 5 health priorities for Core20+. And lastly, to join up or work in collaboration and assimilate the Core20+ goals. Yeah, so this slide just shows some pictures when we had training sessions with our community connectors. So yeah, we recruited 30 Caribbean and African people from our community with lived experience. They went through an interview process and then they were recruited and then trained for a couple of weeks. So this was one of the training sessions we had on co-production. And the next slide is just community connectors engagement at a health fair community events. I think we had early last year or this year. Okay, so this last slide was just to give a case study. This next slide was to give a case study of how our community connectors has worked with a GP in central Manchester. But I think for some reasons, my slide will be, I won't be able to play the video anymore. So I would just, I think the link to the video will be attached on the website. So maybe you could have a look later on. But then I would just want to provide a case study of how well the Community Connectors program has worked. So there was a maternity care project that involved a charity organization called AfroCats, and then working in partnership with CAHN, Caribbean and African Health Network, and then the ADWIC alongside PCN. And then the maternity care project was, the aim was to address barriers to maternity care for women through culturally specific approach. So that was dance, and then using creative measures. And then the focus was on women experiencing poor health outcomes. They included single mothers, married, and widow, but then refugees and asylum seekers. And then there was already like an existing group, women from the Little Lions group. And then, just like I said, it was a partnership with another charity, AfroCats, CAHN, and then ADWIC alongside PCN. And then during some of the, whilst we're undertaking the project, was to hold consultation with women in the community to identify their health needs and work collaboratively to find out barriers and avoid making cultural assumptions with the support of the community connector. So how it worked was that I think for 2 hours at every session, and maybe the first hour is used to engage the women in dancing and feel connected to improve their well-being. And then the next 1 hour, and we invited a clinician. So some of the clinicians that were invited to the projects during the session was a midwife, a health visitor, a social prescribing link worker, and I think a nurse and one other clinician. And then basically the midwife, for example, came into the session to address some of the questions and concerns of the women, some of the barriers that they've experienced or faced in maternity care, their journey so far. It was really useful for those women because there were some of their concerns generally were addressed at those sessions. And then the community connector, using her lived experience of maternity, was able to like connect well with the women and then create that safe environment, safe space for them to express themselves, which they would not usually do on a normal day. And then in terms of like the learnings, I would just want to state the findings and then the outcomes. So in terms of findings, language barrier presents considerable difficulties for the women to access frontline services. So yeah, most of the women were had difficulties with communicating well in English. And then the women faced multiple difficulties in life, which affected well, their general lifestyle as a whole, childcare support, even understanding some of like these free resources or services. For example, there was a woman who didn't know about Sure Start until the maternity project was set up. There was that level of distrust for healthcare systems as a whole. And there's that gap in GP signposting women to frontline services just because of the language barrier. So a practical example was a woman who wasn't able to communicate well with her GP because she couldn't like really speak English, and then the GP was finding it difficult to understand her. And so there was that gap in signposting her to the relevant service for support. And then in terms of like the outcome, the project provided a safe environment, like I said earlier, for the women to share concerns and ask questions that were beneficial to their maternity phase. And the women on the project are now more informed of services available to them within their community, and they are very much empowered to make healthy lifestyle decisions. Without the project, definitely wouldn't have been possible. Just to read 1 or 2 connectors' feedback so far. One of them said, working with my neighborhood team has built my confidence and also given me the platform to make useful suggestions to drive change. I thought I knew what was going on in my neighborhood until I became a connector. This role has given me the opportunity to know more about the activities, initiatives, and projects going on in my area. And the connector's role has bettered an interest for me, for health promotions, and I'm really passionate about supporting in developing and producing care pathways to improve the health outcomes of service users in my locality. So in terms of learning insights for the Community Connectors program, I just want to highlight some achievements so far. In terms of co-production and development of care pathways, I think that's been achieved in one of like the PCN engagements. Co-production planning sessions for development of bowel cancer, discussing existing barriers and potential enablers to enhance healthcare outcomes for a cohort of people with hypertension, co-designing health campaign events for specific targeted groups to improve health outcomes, connecting with targeted maternity groups experiencing poorer health outcomes using creative measures to improve the health and well-being, and also addressing health literacy and addressing challenges within maternity care. Okay, so I'm going to stop sharing my slide now and give room